Hi there, it's Teresa from Chino Valley Pelvic PT. I'm uploading a series of videos right now, and one of them, this is in response to a request from a colleague of mine. I went to Bachelor's of Physical Therapy in the Philippines at Silliman University, and one of the professors there right now, Mr. Severino Torres, he requested that I do a video upload on McKenzie extension bias exercises, and this has been a long process of me trying to upload back exercises. So Mr. Severino, I'm really sorry I haven't done it like as you requested immediately, but I was able to find some new studies, and I hope that you would be able to share these in your class, and I hope I'd be able to live up to what you guys expected. And then in the meantime, I do have the extension exercises, and I will try in the near future to give the exercises instructions in Visayan and hopefully in Tagalog, so that it's easier to give as home exercise programs for our less fortunate patients. Okay, so one of the I think I came across 3 new studies. So the first one that I came across with is by Owen et al. I actually just chose recent ones. This was done in 2020. It is a meta-analysis and by the British Journal of Sports Medicine, and it just shows that for this is for chronic low back pain and for non-specific low back pain, Pilates, stabilization, motor control exercises, resistance training is actually most effective, although there is low quality evidence for that. And it shows that for McKenzie, or for more passive, although they are active range of motion exercises, they are considered to be not as effective for chronic, non-specific. But then again, for physical therapists, we know that McKenzie exercises are more directed for specific for disc injuries. Now, given that, our next study is by Decompose et al., done in 2020 as well. And this one, I kind of paraphrased and summarized that while teaching a patient McKenzie exercises, it does not prevent the recurrence of back pain. It does, however, provide the patient the capability of managing their back pain experience when it does come. So it empowers the patient the ability to do the exercise and thus give them the ability to manage their back pain in that moment, so they don't have to go rush to ER because they have that back pain. So it empowers them. So very good when they do know how to make or how to do the McKenzie exercise. So yes, teaching McKenzie exercises. The third exercise is on the cost effectiveness of McKenzie exercises. Now, given the recent incidents and the recent rise of telehealth, this group of therapists, this was another study done in 2020 by Hatoye et al. And this was actually done in Nigeria. It compared a group, this was a randomized control trial, which is a let's see, of 47 remote patients compared to 50 clinic-based patients. And in their study, they were able to find no significant difference at 4 and 8 weeks to patients who were doing remote versus patients who were doing in person. And they were actually able to cut cost. Now, this is specific to McKenzie exercises for low back pain. This is not to say all rehab exercises would be appropriate for telehealth, like pelvic floor exercises, for instance. Alrighty, so in the next slides or the next exercises, I shall be performing some of the exercises in or demonstrating McKenzie exercises. So I'll see you then. And then just so we get this clear, because I'm also some of I'm targeting specifically for my Instagram, Facebook, and YouTube account. I am also targeting pregnant, prenatal, and postpartum patients. On-prone positions are not really recommended for pregnant patients, so modifications of the exercises for pregnant patients will be either in quadruped or hands and knees positions or in standing. Or talk to your pelvic floor physical therapist. And then when we talk about doing the exercises, when you do the exercises and your pain actually decreases, that means you're on the right track. When your pain increases or it becomes more generalized or your pain increases in the area, then that means your pain or that exercise might actually have to be modified by your therapist, or that is an indication that you might have to change that exercise and it's not the right one for you. In the meantime, I hope you have a safe and fun time doing the next set of exercises I will show you.